Testing, testing, 1, 2. Great, so here you can see me. Hi, I'm John Walmart. You've not been able to see me before, but so I am a physiologist, and I recognize that there are 3 levels at which we can cover this material. The highest level is from the perspective of an anatomist or physiologist. The second highest level that we can cover this material is from the perspective of a medical doctor, and the third highest level that we can cover this material is from the perspective of a normal medical practitioner, a nurse, a radiologist, that sort of thing. And I recognize that a lot of my students are nursing and radiology majors. And so with that in mind, I'm actually going to switch to a different set of PowerPoint slides. We've been covering this from the perspective of a med school student, or sometimes from the perspective of an anatomist or physiologist, which is, I recognize, higher than is required. So I'm going to switch, at least for the bone unit, over to a different set of slides to finish out the axial and appendicular skeletons. All right. So we covered the cranium and the skull and all in depth. And actually, let me back out here and make sure that you can see the slides. Okay. Great. So we covered that quite in depth, and that's great. The one thing we did not cover in depth is the foramina of the skull, which are the tiny holes or openings that allow for the passageway of nerves and blood vessels. Those may be important depending on which program you're in. You may need to know them to know the cranial nerves which pass through. Okay. All right, so we've talked about bone markings. All right, just moving through. We've covered the bones of the skull. Just moving on. Here we have the vertebral column. Now the vertebral column is divided into a number of regions. The first up is the cervical region. Now the word cervix, you should probably know, refers to the neck. There's another cervix that people commonly refer to, which is the cervix of the uterus. That is the neck of the uterus, or the opening to the uterus. All right. Now here, when we use the word cervical, we are referring to the actual neck of a person. Now, inferior to that, we have the thoracic region. All right. The cervical region has 7 vertebrae. The thoracic region has 12. Inferior to that, we have the lumbar region, which has 5. And inferior to that, we have the sacrum. Now, the sacrum is composed of 5 vertebrae that have been fused together. Many textbooks will treat the sacrum as if it is one bone. However, we can still refer to the individual levels of the vertebrae. So up top, of course, we'll have the first sacral vertebrae, and the second, third, fourth, fifth. All right, and beyond that, we have the coccyx, which is commonly known as the tailbone. Now, the tailbone is composed of 3 to 4 vertebrae. Now, this is variable between individuals. In most people, it'll be about 4, but they're fused into one bone, so many textbooks will treat this as if it is also one bone. Okay? Now, you're going to love this. The nomenclature for the vertebrae is actually quite simple. In fact, they're the easiest bones to memorize. And so we have in the cervical region the first cervical vertebra. It is known as C1, cervical vertebra 1. The second is known as C2, cervical vertebra 2. All right, so as you can see, this carries on down 3, 4, 5, 6, 7. Moving into the thoracic region, the first thoracic vertebra is T1. Okay, the second is T2. Now there are 12 of them, so we move on down all the way T1 through T12. And then we move into the lumbar region. This is your lower back. And here we have L1 through L5. Okay. And then finally from there, we move into the sacrum, which is 5 fused vertebrae. We can refer to the regions or the levels of the sacrum as S1, S2, S3, S4, S5. However, many people in many textbooks will treat the sacrum as if it is one bone. But we can refer to the levels of it as S1, 2, 3, 4, 5, because there are 5 vertebrae here which fuse together pretty early on in development. Now, beyond that, we have the coccyx. All right. Now, some textbooks will treat this as if it is one bone. Many will treat it as if it is one bone. But there are potentially 3 to 4 coccygeal vertebrae. All right. So this will be CO1, CO2, CO3, CO4, if you have to refer to the individual regions of the coccyx. So the coccyx is an interesting bone. It is, I may have said vestigial. It is a remnant of a tail left over from our ancestors. When you hear stories about a human who was born with a tail, what's actually happened is that the coccyx, instead of being oriented anteriorly in that individual, is oriented posteriorly and protrudes through the skin. All right. So they haven't actually developed new vertebrae. They haven't developed a tail that was not present in other humans. The vestigial remnant of the tail that was present in our ancestors, the coccyx, is now oriented posteriorly and pushing through the skin. All right. So a couple of defining features of the vertebral regions. In the cervical region, you can see here these holes, right? Along the side, okay. All right, and so those are the oh my gosh, the name's escaping me all of a sudden. The transcervical vertebrae? No, the transcervical foramina. These are foramina that allow for the passageway of nerves and blood vessels. I'm sure it'll come back to me in a second. Sorry about that. And they are characteristic of the cervical vertebrae. They allow, yes, for nerves and blood vessels exiting the cranium to pass through. Here in the thoracic region, we find costal facets and demifacets. Now, a facet is a depression or sort of a shallow, smooth depression that allows for articulation. And what's really special about the thoracic vertebrae is that every thoracic vertebra, T1 through T12, they articulate with the ribs. Now, some vertebrae will articulate with more than one rib. All right, and you'll find these facets and demifacets both on the vertebral body as well as on the vertebral arch here, okay? And so the rib may articulate in 2 places, posteriorly with the vertebrae, okay? Now, only thoracic vertebrae will articulate with ribs, and ribs will only articulate with thoracic vertebrae. Now, here's kind of a foresight into what we're about to see. You can go ahead and ask yourself, how many ribs are there? And the answer is 12 pairs, okay? 1 left, 1 right for every level. T1 has a left and a right, T2 has a left and a right, and so on down. I asked this question because there's a common misconception out there, and it's somewhat religious in nature, and that's that the Christian God created Adam and then pulled from him a rib and created Eve. And I'm not saying that's a misconception. I have no place to make any comment on that whatsoever. However, many people extrapolate from that all men will have 11 ribs and all women will have 12 because men gave up one to create women. And that's the misconception. The Bible actually never says that anywhere, that from then on all men would have 11 ribs. In fact, there was a test on the statewide testing. I remember when I was a middle school student, and it asked, a cat loses its tail. It's run over by a car, loses its tail, but it survives. How many of its kittens a month later have tails? And the answer, of course, is all of them. Why would any of them lose a tail, right? And so just keep that in mind, please. Men and women have both 12 pairs of ribs. Yes. All right, so moving on, we have the lumbar region with its 5 vertebrae. And there's nothing particularly special about the lumbar region. It does not have costal demifascists. It does not have the transverse foramina of the cervical region. However, the lumbar vertebrae, if you were to find one by itself, they are larger than the other vertebrae. They have much larger bodies, they have much larger transverse processes and spinous processes and vertebral arches. They are in general just much, much bigger than the other vertebrae. And in fact, if we look back at the top of the column, they start out quite small and they decrease in size as we move down the vertebral column to the lumbar region. And the reason for that is that every vertebra supports the weight of the vertebra above it and all of the tissues above that. So C1 supports basically the skull. All right, C2 supports the skull and all of the pressure that's on C1. C3 supports the skull and all of the pressure that is on the tissues of the level of C1 and C2. And so we go on down here, and the first lumbar vertebra is supporting the weight of the body above the level of L1. So everything from here on up is being supported by L1. L2 is going to need to be a little bigger because it's supporting the level of L1 and everything above it. All right. And so by having a larger vertebral body, we can spread out that pressure and we can spread out that weight across a larger surface. Okay. All right. So then we move down to the sacrum with its 5 fused vertebrae, very characteristic, very easy to pick out, of course. And then the coccyx with its 3 to 4 fused vertebrae, easy to pick out as well. Now the intervertebral discs, they separate the vertebrae from one another, and they're located between the vertebral bodies of the vertebrae, those cylindrical masses. All right. And what they do, they're made of fibrocartilage, by the way. They support the weight of the vertebrae above and all the levels of the body above that vertebra. Now they're composed of 2 parts. The outer part is made of fibrocartilage, and then there's a pulpy inner part called the nucleus pulposus, or the pulpy nucleus. And when people have a condition called sciatica, which I actually have, I've suffered relatively extreme pain from it this summer. What happens is that they have a herniated disc and the nucleus pulposus bulges out through the side. Now the outer regions are made of fibrocartilage, and so this pulpy nucleus is squeezed and pushed out through the sides. And when that happens, it actually pushes on the nerve roots that give rise to the sciatic nerve, and we'll talk about that in the nervous system unit. All right, but basically when you push on the nerve roots that give rise to the sciatic nerve, you're going to create pain and numbness that runs through the path of the sciatic nerve, and it runs down the posterior region of both of the lower limbs. All right. All right, now for the parts of the vertebrae, here we have the vertebral body, this cylindrical mass, which, yes, is wide and large and specialized to spread out the pressure of all the weight that it's supporting. All right, this is a superior view, by the way. Then here we have the vertebral arch. The vertebral arch is this arch or half circle that encloses the posterior aspect of the vertebra. Okay? Now, the regions of bone that connect the arch to the body are known as the pedicles. This region here are known as the pedicles. All right? Coming off to the side, we have the transverse processes. Okay? And just about all vertebrae should look like this, or at least somewhat like this. In the cervical region, they can be kind of small and different. And then, of course, in the cervical region, you'll also have the transverse foramina. That's the word I was looking for earlier. The transverse foramina located roughly in this region. Okay, off to the sides. All right, so we have the transverse processes coming off, and then we have this region known as the lamina, and the lamina connects the transverse processes to the spinous process. The spinous process is this pointy bit of bone that sticks out posteriorly. So when you look at a vertebra, whether it's in the superior view like this or the lateral view over here on the right, you should spot the spinous process immediately and know that it points posteriorly. So how do we remember that? If we look at this model up here, okay, you can see that there are all these bumps running down her back. If you've ever been at the beach and you've seen someone quite skinny, or the pool or something like that, you've seen someone who's very skinny, and you see these bumps pointing out of their back running down the path of the vertebral column. Those are the spinous processes. They point out posteriorly, okay? And so when you look at a vertebra, you should remember immediately that, of course, the spinous process points out the back. So this is the posterior region, and then the body will be anterior to that, okay? Good. Have we talked about everything? I think so. All right. Now, one last thing, sorry. The vertebral canal is this region within the vertebral arch. Between the vertebral body and the vertebral arch, we see the vertebral canal. The vertebral canal is actually an opening or a space that is created by the presence of the vertebral body and the vertebral arch. All right, so in between them, we find the vertebral canal, and that's where we're going to find the spinal cord. Now, the spinal cord passes through the vertebrae from the foramen magnum in the occipital bone all the way through C1, all the way down through all the way down about L4. Around L4, the spinal cord actually terminates, and we'll talk about that more in the nervous system unit. All right. Now, there are a couple of bone features we should be aware of. Here we have labeled a facet, okay? This is a vertebral facet. Specifically, this is the superior articulating facet. Now, why is this the superior articulating facet? Well, because it is superior to the vertebra that we are looking at, right? So whatever vertebra you're looking at, you're going to find a facet here that articulates with the vertebra above it. All right, and so if we go ahead and say, let's look here, we see demifacets, so these have to be thoracic vertebrae. Let's go ahead and say this is T7, okay? This is T7. The superior articulating facets of T7 will articulate with or form a joint with the inferior articulating facets of T6. Okay, now it's not pictured here. Let's go ahead and pretend this is T7 here. We'll see T6 right above T7, right? And so the superior articulating facets of T7 form a joint with the inferior articulating facets of T6. Okay? Now, there are a couple of things we mentioned. Here is a facet or demifacet. Here's a facet for a rib. Okay, these are also known as costal facets because the costal bones are the ribs. The ribs are known as the costal bones. And so they articulate with both the demifacets on the vertebrae and the facets on the transverse processes. Okay. And so a rib will articulate with the vertebral column usually in two places. Not all of them, it's not always true, but usually in two places it will articulate with the body and a transverse foramina. Now, from the view here, we see the spinous processes, and so we know this is a posterior view. We know the facets we are looking at are on the right side, and so if this is T7 up here, we can reasonably say that costal bone 7 or rib 7 is articulating here with the vertebrae. Okay. This would be the right costal bone or the right rib 7. Okay. The left would be on the other side. It's important to remember that the ribs come in pairs. That's very easy to forget. There are 24 costal bones. They come in 12 pairs or 12 sets of 2. All right. All right, so the vertebral column, we've mentioned this. The first two cervical vertebrae are different from the others. They're different in shape and they're different in name. So we said the first cervical vertebra, you can go ahead and call it C1. Technically, that's true, yes, but it has another name. The other vertebrae, C1, C2, they have names. After that, don't worry about it. All right, now C1 is known as the atlas. C2 is known as the axis. And I'm sure you're up on your Greek mythology, so you probably know that Atlas is the Titan who carried the world on his back. Maybe you are, maybe you aren't, and that's okay. But surely you've seen shirts for the Atlas gym, right? And they show that big muscle guy carrying the world on his back, right? All right, so we should just know at this point that Atlas was the Greek mythological feature who carried the world on his back. All right, and so C1 is the first cervical vertebra, and it carries the skull on top of it, right? It supports the skull. So it's very important for this region. The skull contains our brain, and our brain is basically, yes, our entire world. All right, now there are superior articulating facets on C1. Okay, here's a superior view. Over there is that's a different cervical vertebra actually over there on the right. On the left, here's a superior view of C1. Sorry about that. These superior articulating facets, what do they articulate with? What do they form a joint with? It's not another vertebra. This is C1. It's the top vertebra. All right, so they articulate actually with the occipital condyles of the skull, specifically on the occipital bone. The superior articulating facets articulate with the occipital condyles, all right, rounded projections of the occipital bone. And this vertebral foramen lines up perfectly with the foramen magnum of the occipital bone. And so the spinal cord exits the skull through the foramen magnum and passes down through this vertebral foramen. Let's go back to the skull. I'm sure we've got a good picture here. No inferior view. Wow. Oh, here we go. Okay. All right, so here you can see the occipital condyles. These are rounded processes, and they articulate with the superior articulating facets of C1. Now here we have the foramen magnum, which is a big hole, and that's what the name means, foramen hole, magnum, big. All right. And so we see the spinal cord passing through the foramen magnum and entering the vertebral canal. And the superior articulating facets of C1, they articulate with, yes, the occipital condyles of the occipital bone. All right, and so, good, that's the atlas covered. The Greek mythological feature supported the entire world. Our bone, named the atlas, C1, supports the skull, which is our entire world, basically. The curved nature of the superior articulating facets and the rounded nature of the occipital condyles allows the skull to actually rock up and down on the superior articulating facets here. That'll be important in a second. I'll pull up the webcam. Down here we have C2, which is the axis. Axis is the name of C2. Its superior articulating facets, they articulate with the inferior articulating facets of C1, and those actually aren't pictured here, but they are on the bottom side of C1, and they will articulate with the superior articulating facets of C2, the axis. We also see a bony projection here on axis, the axis, that is known as the dens or odontoid process. That's a funny, fancy name. Dens will do just fine. You see dens right here. All right. So this is a superior view. Then over on the right, we have a lateral view that will show you that the dens pokes straight up. And when it pokes straight up, it actually infiltrates this region of the vertebral canal of the atlas, or C1. Okay. Why is that important? Let's go to the webcam. All right, you can see me here? Good. So the atlas supports the skull. It supports our whole world. And because of that, because of the rounded nature of the occipital condyles and the rounded nature of these superior articulating facets, we can rock our head up and down in a yes motion. And so to remember that, what I always ask my students to remember is, did Atlas carry the world on his back? And the answer is yes, right? All right, so we can make this up-down yes motion because of the rounded occipital condyles and the superior articular facets of C1, the atlas. Right. All right. Now for the axis, all right, that odontoid process allows C2 the odontoid process of C2, this bony projection which points up, allows C1 to rotate right and left laterally, okay? And because of that, we can make the left-right no motion. So I asked my students, did Atlas hold the world on his back? The answer is yes. Did Axis hold the world on his back? The answer is no. Who's that? Because Axis isn't a figure from Greek mythology as far as I know. All right, so the correct answer is no. Axis did not hold the world on his back. Atlas, yes, did. Okay. All right. Going back to the screen view. From there on, C3, C4, C5, T1, T2, they don't really have special names. You don't have to worry about that. The thoracic vertebrae, we mentioned they have facets and demifacets. Now, a facet is a whole depression, and a demifacet is half of a depression that it gets to share with another vertebra. And so if we look at this and we say this is T2, and we say this is T1 up here, you can see there's a demifacet here and a demifacet here. And when these two bones come together, they will form an entire facet, okay, on their body. Why is that significant? Well, what it means is that rib 2 articulates with the transverse process, rib 2 articulates with the transverse process of T2. Back here, okay, there's a whole costal facet right here. It also means that it articulates with the demifacet of T1's body and the demifacet of T2's body, okay? It's going to articulate with, yes, these are two halves that come together to make a whole. It will articulate with this whole facet between T1 and T2. It'll also articulate, that is rib 2, with the transverse process, this facet for T2. All right, so not all ribs will have a transverse process. Not all, I'm sorry, let me back up a second here. Not all vertebrae will have demifacets on their body. They will all have transverse processes, and they will all have full facets on those transverse processes. Not all of them will have whole facets on the body. Some will have whole facets, some will have demifacets. And for our purposes, again, because we are covering this at a, shall we say, a functional level as opposed to a deeply academic level, it's probably not worth our time to memorize which vertebrae have demifacets, which thoracic vertebrae have demifacets. Of course, we should know that all facets, all of these costal facets, will only be found on thoracic vertebrae, whether they are a demifacet or a full facet, a whole facet. They will only be found on thoracic vertebrae because the costal bones, the ribs, only articulate with thoracic vertebrae. All right, so next up we have the lumbar vertebrae, which don't have anything really cool about them. The cervical vertebrae had transverse foramina. All right. The thoracic vertebrae had costal facets and demifacets. And so you could look at those right away and you could tell this is a cervical vertebra, this is a thoracic vertebra. If by some chance you found yourself in the Mortal Kombat universe and you just found random body parts laying around, or if you were a forensic anthropologist like that lady on Bones, you just found bones laying around. You could look at it and say, oh, this is that bone, right? The lumbar aren't like that. The lumbar vertebrae aren't like that. They don't have any special features that tell you they are this bone or that bone. However, if you have the entire skeleton, you can tell it pretty easily because the lumbar vertebrae are larger, much larger than the other vertebrae. Not only do they have a larger vertebral body, they will have a larger vertebral arch, and along with that, much larger transverse processes and spinous processes. And the reason for that is that the muscles that act on the back, specifically the lower back, and the muscles that act on the legs, some of them, will insert on the vertebrae of the lumbar region. And so the movement of our legs is partially dependent on attachments to the lumbar region of the spine. I've never thought about it before. I'm just spitballing out loud, but that could be the reason that it's something like 80% of American adults experience lower back pain. Humans do not always walk upright, and it's not the most effective way to get around. We're actually developmentally relatively new to this idea of walking around, and that's why the death rate for both babies and mothers, unfortunately, during childbirth is so high, is that our pelvis is not oriented properly for it. I'd love to talk to you about that some other time, but I guess now's not the time. Let's get back to the material at hand. All right, so the vertebral column. So we have a triangular shaped sacrum, which ironically looks like an upside down triangle. We very rarely see those in geometry class. The base of the triangle is the superior margin, and then it has lateral angles which point down or inferiorly. So we can see that. It's composed of 5 vertebrae. They fuse together between the ages of 16 and 18 years of age. That is to say, they finish fusing together by those ages, 16 to 18. It's fully fused by 30 years of age. And the sacrum forms the pelvic girdle. All right. The coccyx is also triangular in shape, and it's composed, it says here, 4 vertebrae, 3 to 4. There's some variation. they fuse together between the ages of 20 and 30 years of age. So here we see the sacrum here. It looks like an upside down triangle. All right, its base is the superior margin. All right, its apex is actually the inferior margin down here. And it's composed of 5 sacral vertebrae, 1 through 5. That's 1, 2, 3, 4, 5. We can refer to the individual levels of the sacrum as, yes, S1, 2, 3, 4, 5. Now moving down, we have the coccyx, or tailbone, which is composed of 3 to 4 coccygeal vertebrae. Again, these are remnants of our ancestors, and given enough time, they will probably disappear from humans. But for now, they're there. And so we have the coccygeal vertebrae CO1. Now this is CO to differentiate the coccyx from the cervical vertebrae, which are labeled C1 through C7. These are labeled CO1 through 4. All right. And again, these 4 vertebrae are fused together. So many textbooks will treat the coccyx as one bone. I had a friend, we went out to Cherokee Park in Louisville one winter when it had snowed about a foot, and class was canceled for us for about a week. And we should have gone on day 1. What we actually did was we went on day 7, and I brought my snowboard, he brought his sled, we brought some other friends who were going to go down. He was the first one to go, and he's going down the hill, and he hits a ramp. And, we thought, you hit the ramp, you go up in the air, then you land on snow, you're okay. Well, Cherokee Hill can be pretty steep in places, and he goes down, he hits the ramp, he goes up, and then with the arc, he winds up actually falling like 20 feet onto his back. And he's unconscious for a little bit, maybe 30 seconds. He's not moving. And after about 30 seconds, he starts kicking. And at the time I was just an undergrad, and I said to our friends, just give him a moment to compose himself. You know how guys are. They don't want you running in when they're like crying and having a fit. They want you to give them a little bit to get their act together, I guess. And so I said, give him his moment. And we waited another 2 minutes, and he's still just kicking. And I said, okay, let's go check on him. We get down there. He is unconscious, and he's convulsing. He's in so much pain. And when he finally comes to, when he finally regains consciousness, he is crying and screaming. And the paramedics come, and they eventually get him onto a bed where they can slide him down the icy hill and then get him to an ambulance and get him to the hospital. And the diagnosis at the end of the day is a broken coccyx. So when someone tells you that the coccyx has been broken, that they have broken their coccyx, the moral of the story is that it can be incredibly painful. It can be incredibly painful. He lost consciousness, was convulsing, was kicking, and then when he finally regained consciousness, was crying, sobbing deeply. And I don't say this to mock his pain, not at all. I say this maybe to mock our hubris and stupidity in thinking that we could take a ramp that by day 7 of a snowstorm had obviously melted and refrozen into ice. But I'm off topic. Let's get back to the topic. The whole point of switching to these slides was to save us all both time and mental energy, so I will try to keep that in mind. All right, so the sternum is also known as the breastbone. Now, the breastbone is the colloquial common English name, and so that in a medical setting will not be the appropriate name. The appropriate name is the sternum. All right, so it is a flat bone. It's located in the center of the thoracic wall anteriorly, and it's divided into 3 parts. The upper portion is known as the manubrium. The middle portion is known as the body of the sternum, or corpus sterni, that is the Latin name. And then the lower portion is the xiphoid process. When you're giving CPR, you have to watch out for the xiphoid process. It's easy to break. The xiphoid process is also interesting just because it's variably ossified. I say there are different number of bones in different people, right? It's variable. And this is another example. The xiphoid process in some people will be ossified. It will be turned into bone. And in others, it will not turn into bone. It'll remain cartilaginous for your entire life. So I say these bones usually fuse by the age of 25, right? And at 25, either it's turned to bone or it's cartilage. And at that point, if it's still cartilaginous, you could probably live to the age of 90 or 100 and it will still be cartilage and just never turn to bone. All right, now the manubrium is the attachment point for the costal cartilages, or the cartilages of the ribs, right? And so up here we see rib pair 1. Here's a left, here's a right. We see rib pair 2. Here's a costal bone 2, left costal bone 2. Here's a right costal bone 2. Down here, left costal bone 3, right costal bone 3, on down until we get to here's 10, 11, and 12. All right, so both men and women have 12 pairs of costal bones. They have 12 pairs of ribs. There's a right and a left for each level. All right, easy to remember, right? Because there are 12 thoracic vertebrae and there are 12 ribs for both men and women. Now, pictured here in brown are the cartilages. And when we look at these skeletons, this is a real skeleton. And many of our colleges will have, especially the Southwest campus, have real old-fashioned skeletons that were donated by people who died. All right, and on those, you always see these costal cartilages that are brown. And I've actually never been able to figure out, while the bones I know for certain are real, I've never been able to figure out if this cartilage is real. Never been able to figure out if that's something that some anatomical supply company added or if it's real cartilage that's just aged. Either way, let's get back to the topic. Here we see the sternum. The upper portion here flared out. That's the manubrium. Down here, this dagger-like portion, that is the corpus sterni, or body of the sternum. And then down here, this pointy bit is the xiphoid process. Okay. Oh, sorry, I heard noises coming from somewhere. It's just my wife. All right, so what else do we have here? Yeah, true versus false ribs. We have to talk about that on this image. So the true ribs are those ribs whose costal cartilage directly attaches to the sternum. So if we go in here and look, we see rib 1, 2, 3, 4, 5, 6, 7. They all directly attach to the sternum. So those are the true ribs. You've probably heard of false and floating ribs before too. If not false, then you've probably heard of floating ribs. All right. The other ribs are false. 8, 9, 10, both left and right, as well as 11 and 12 are all technically false ribs. Why? Because they do not have costal cartilages that directly attach to the sternum. So let's go ahead and justify that. Let's go ahead and look at rib 8, 9, and 10. In fact, rib 8 is the best example to start with. You can see the cartilage attaches not to the sternum, it attaches to the costal cartilage of rib 7. Rib 9's costal cartilage attacks to the costal cartilage of rib 8, and 10 in turn attaches to the costal cartilage of rib 9. 8, 9, and 10, they have costal cartilages that do not attach to the sternum, and so they are false ribs. They do attach to the costal cartilage of rib 7, but they do not directly attach to the sternum, and so they are false ribs. Now, 11 and 12 also do not have costal cartilages that attach to the sternum, so they are also technically false ribs, but these two ribs get a special name because they don't really have much, if any, costal cartilage. All right? They don't even bother trying to attach to the sternum or to the costal cartilage of another rib. All right, they don't attach to anything anteriorly, and so they are known as the floating ribs. They just kind of stick out here. All right, so they're known as the floating ribs. They're not truly floating, they're just not attached anteriorly. They are, it should be mentioned, they are attached posteriorly, okay, to the vertebrae. So that was a long-winded explanation. Basically, ribs 1 through 7, true ribs. They attach to the sternum. 8, 9, 10, they're false ribs. They attach to the cartilage of 7. They do not attach directly to the sternum. 11 and 12, they're technically false ribs because they also don't attach to the sternum, but they also get the special name floating ribs because they don't attach to anything anteriorly. So here we see the sternum again, body down here, corpus sterni, Latin name, manubrium, upper portion, and the xiphoid process down here is variably ossified. It may turn to bone, it may not. So the ribs provide support to the thoracic cavity, and of course there are 12 pairs, numbered 1 through 12, left and right. Okay. They extend from the thoracic vertebrae to the sternum, except for 11 and 12, of course. Now, the costal cartilages we were just looking at in brown here in a living individual would be made of hyaline cartilage. All right, so we've covered all this. Good. So moving on, we have the appendicular skeleton. This refers to the appendages. Of course, in this image, you can see that the axial skeleton is in blue and the appendicular skeleton is in this proper bone color. Now, the appendages, those are your limbs, they are attached or appended to the axial skeleton. That's where the appendicular skeleton gets its name. So both the upper limbs and the lower limbs, which are commonly called the arms and legs, are attached by either a pectoral girdle in the case of the arms or a pelvic girdle in the case of the quote-unquote legs. Now again, just to reemphasize, I do have to be specific here because the word arm anatomically only refers to this upper arm region where we find the humerus bone. This region down here that you might call the forearm is the antebrachium, and it is not the arm. The arm up here is the brachium. Forearm down here is the antebrachium. Now in the legs we have the thigh or femoral region where we find the femur, and then down below we find the leg proper, okay? And that's referred to as the sural or the crural region, depending on whether or not you're looking at the anterior or posterior view. Crural anteriorly, posteriorly is the sural region. You find the calf muscle in the sural region. Okay, sorry, it's a lot of talking. Hard to keep your wind up, your breath up after all this. All right. So the pectoral girdles consist of the scapulae and the clavicles. Okay. Now you can look in the back here. Here's a scapula. It's also commonly known as a shoulder blade. You also have the clavicles, which are commonly known as the collarbones. Okay. Collarbones, or clavicles, by the way, are the most commonly broken bone in the body. And frequently when they break, all you can do is put the arm, the affected arm, in a sling and immobilize it for a period of time. I have had a few students report that they've undergone surgery to repair a broken clavicle, but that's relatively rare. Typically, they'll just put you in a sling and send you home. All right, scapula is the shoulder blade. Good. And this attaches the arm to the axial skeleton. Technically, the only point of contact between the upper limbs, or quote-unquote arms, and the axial skeleton is here at the sternoclavicular joint where the sternum meets the clavicles. Pretty easy name to remember, right? Sternum meets the clavicles at the sternoclavicular joint. This is the only point of contact between the upper limbs and the axial skeleton, technically. All right, so this is an anterior view. We flip over, we see the scapula in a posterior view, and the scapula is suddenly way more interesting in the posterior view. You can see here the scapular spine, which comes up to a flattened region known as the acromion. Now, the acromion, back over in the anterior view, also forms the acromioclavicular joint, which is the joint between the acromion of the scapula and the clavicle. Okay, over here laterally. All right, so that's the acromion. We come down the scapular spine, which is spine again, the sharp projection coming out of the bone. And there are a couple of fossae here, or shallow depressions. Here is the infraspinous fossa, infra meaning below, so below the spine, infraspinous fossa. Up above is the supraspinous fossa. Okay. Now we flip over to the anterior surface, and there's another depression here called the subscapular fossa. Why are these important? Because we're going to talk about it again when we get to muscle. There are muscles here, and they're named for the fossa they're found in. So the supraspinous fossa houses the supraspinatus muscle. The infraspinous fossa houses the infraspinous muscle, and then the subscapularis is a muscle that will be found in the subscapular fossa. Okay, so these are all muscles that act on the shoulder joint. So the scapula, it's worth mentioning while we're here, there is an acromial border. Up top, there is a medial or vertebral border. That is, this border borders the vertebrae, so it's the vertebral border. And then there's an axillary or a lateral border that borders the axilla, the armpit. Okay. Here's the clavicle here. The sternal end is going to be vertically flattened, right? So if you had this in front of you from top to bottom, the sternal end, the end toward the sternum, would be flat. The acromial end is horizontally flat. So if you held it in front of you and turned it, it would look flat as you look straight at it, as opposed to looking at it from above. Clavicle, not a whole lot else to say about the clavicle. The scapula here, we've pointed out the acromion already, this flattened process at the top, which forms the acromioclavicular joint. Antero-inferior to that, we find the coracoid process, which is this bony finger of bone that just kind of points out there. That's the coracoid process. These are both attachment sites for muscles, tendons and ligaments, right? We find the glenoid cavity. That's very important. You can't see it very well in this view. Do we have a better picture? Yes, over here. This is a lateral view of the scapula. And here we're looking in, and you have this depression here, this concave surface, and it perfectly accommodates the rounded head of the humerus. And so when these two come together, you get the rounded head of the humerus and the concave surface of the glenoid fossa. You get a ball and socket joint. Ball and socket joints, there are really only a handful of them in the body, but they grant a significant degree of flexibility. And so if you go ahead and move your arms around, you can rotate your shoulders, something like 360 degrees. If you're incredibly flexible, it's possible for you to do the same thing with your legs, although most of us are not going to be that flexible. Those are ball and socket joints, the hip and the shoulder here, between the rounded head of the humerus and the glenoid cavity or glenoid fossa of the scapula. Okay. Good. We've pointed out the scapular spine already. Anything else we want to bring up here? Now I think we're good. Okay, so the next bone up is the humerus, or the quote-unquote arm bone. Now, why is this the arm bone? Because it's found in the arm. And remember, the arm proper is the upper arm, or the brachium. Now, you'll also hear that pronounced by some people as brachium. Brachium, brachium. Either way, it doesn't matter. It articulates with the scapula. Okay, the rounded head here articulates with the glenoid cavity or glenoid fossa of the scapula proximally. Now, it also articulates distally with the radius and the ulna of the antebrachium or antebrachium. All right, the two bones of the forearm. All right. Now, there are a couple of bone features we should definitely point out here. There are two tubercles located proximally. There's a greater and a lesser tubercle. The greater, of course, is larger than the lesser tubercle. And these are both kind of round but rough bony projections. And so they are both perfectly suited to be sites for muscle attachment, that is specifically tendon attachment. Between them, we find the intertubercular sulcus. Remember the word or prefix, inter means between. So the intertubercular sulcus is a sulcus found between the two tubercles. Okay, and we're going to see ligaments pass through the intertubercular sulcus. Okay. All right, so we mentioned the humerus has a rounded head. It has a diaphysis. On the side here is a roughened region known as the deltoid tuberosity. A tuberosity is, again, a roughened region for tendon and ligament attachment. And so here we will see the tendons of the deltoid muscle insert on the humerus. When they contract, they're going to pull on this region of the humerus, which lifts the arm up laterally. All right, so we covered the body, the shaft here. Moving on. So you have some condyles and epicondyles in the humerus. Now, unlike the femur, which has a large medial and a large lateral condyle, as well as a large medial and lateral epicondyles, the condyles of the humerus have special names. And so the rounded one is known as the capitulum, and it articulates with the radius, the head of the radius. The trochlea articulates with the coronoid process of the, it articulates with the there's a better name for this. It's escaping me. So it does articulate with the coronoid process, also the olecranon process. There's another fossa here. That would be better named for it. I'm sorry, that name's escaping me at the moment. But in other words, it articulates with the head of the ulna. Okay? All right, so the rounded process articulates with the head of the radius. The capitulum articulates with the radius. And then over here, the trochlea is actually a V-shaped depression, shaped like the letter V, and it articulates with the coronoid process here of the ulna. And that comes up when you, in other words, flex your arm. The coronoid process is going to fit into a shallow depression right here called the coronoid fossa. When you extend your arm out, when you reach out, okay, you're going to see there's an olecranon process here, and it fits into the olecranon fossa on the posterior side of the humerus. All right, now, what is an epicondyle? These condyles, these are rounded or smooth projections of bone for forming joints or articulations with other bones. What's an epicondyle? Epi means above, right? So the epicondyles are flared out regions of bone found above the condyles. There's a lateral epicondyle and there's a medial epicondyle on the humerus. And both of these they're just flared out rough bits of bone. They are attachment sites for the tendons and ligaments of the elbow. All right? Good. All right. So the ulna and the radius, these are the two bones of the quote-unquote forearm or antebrachium. All right. The olecranon and coronoid processes, they fit into fossae that are appropriately named on the humerus. All right. The radius is located laterally. All right. In other words, in the anatomical position, it's located laterally. It's located on the thumb side. No matter which way you turn your arm, the radius is going to be located on the thumb side. And so the mnemonic that I use and that I encourage students to use is thumbs up for radical radius. Go ahead and stick your thumb up and then follow your finger back from that. The forearm bone that you're running your finger across is the radius. And I'll go ahead and pull up the webcam so that we can all see. Thumbs up for radical radius, okay? This is the radius. The radius is on the thumb side. The ulna is on the pinky side, okay? And in the anatomical position, it may be hard to see, in the anatomical position, yes, the radius is on the thumb side. The radius is also lateral to the ulna, all right? But it doesn't matter which way you twist the arm, right? The radius is always going to be on the thumb side because the radius rotates over the ulna. All right, so radius will always be on the thumb side. If you're looking at a patient, if you're looking at yourself, you're looking at a model, any of it, radius is always on the thumb side because as you twist your arm, the radius twists over the ulna and it stays on the thumb side. So thumbs up, radical radius. All right. So moving on, we have the radius on the thumb side located laterally. Medially, we find the ulna on the pinky side, okay? And in between them is an interosseous membrane or a membrane between the bones. Interosseous membrane between the bones. You also find down here the styloid processes of the radius and the ulna. And it's actually kind of funny. I kind of want to show this. It's maybe a little off topic, but it's always fun. So I'm wearing a Fitbit Ionic. It's my third Fitbit device. But when I bought my first one, the instructions said, wear it 2 inches above your wrist bones. Now, what are your wrist bones? Well, your wrist bones, if I look at my hand here, are actually located here, okay? These are my wrist bones. Now, what people call the wrist bones generally is this pointy bit. The actual wrist bones are up here. There's this pointy bit here. That's what we'll call the wrist bones. Now, that is the styloid process of the ulna. Over on the other side, you can feel it for yourself. It's the styloid process of the radius on the thumb side, okay? That pointy bit of bone there. A lot of people call those the wrist bones. Those are not the wrist bones. The actual wrist bones are located up here, all right? The actual carpal bones are located up in this region, all right? I'm watching myself on webcam. It's a little disorienting. Sorry about that. All right, good. So I don't expect everyone to know that. I don't expect every human being alive to know that. But people who have been through anatomy and physiology, I expect to know that. And people who have found jobs working for the health and fitness company Fitbit, I definitely expect them to know where the wrist bones are. All right. Still, they make, well, I was going to say great tech. It's pretty decent tech. There are problems with it. Their products break much, much faster than they should. That's off topic. The actual wrist bones are down here, by the way. Those are the small, short bones here. Those are the carpal bones, all right, just distal to the radius and the ulna. All right. Okay, great. So here we see the ulna, the head of the ulna. Now, the head of the ulna is, I got to go back to webcam. It's another visual thing. C-shaped. Looks like this. Okay, it's C-shaped. Another way to think about that, it's U-shaped. It's the only bone you look at it and you're going to see a U. Other than, remember the, go ahead and quiz yourself. This one back here, where we find the pituitary gland in the back of the orbit, right? Where we find the sella turcica, that's the sphenoid bone. Right? So other than the sphenoid bone with the sella turcica, which is U-shaped, the ulna is the only bone where you're going to find a U shape as well. All right. And that U shape is composed of the coronoid fossa. Okay, let's find this here. Let's turn this. Coronoid fossa, the olecranon fossa, and the trochlear notch in this region. Okay, that was the word I was struggling to remember earlier. The trochlear notch is this region. And the trochlear notch, this region of the head of the ulna, fits on top of the ulna. Sorry, it's really disorienting to watch yourself in the webcam, especially because left and right are reversed. I'm trying to get this straight. So it just fits in there. The trochlea of the humerus does. All right. So the ulna will kind of act on a hinge here. This is in fact a hinge joint. Okay, so it kind of rotates over the trochlea there. So trochlear notch sits on the trochlea of the humerus. Okay, and then we have the coronoid process and the olecranal process. Okay, and so when we extend the arm, let's go ahead and do it like this. The olecranon process fits into a depression on the back of the humerus called the olecranon fossa. All right. And if I bend, okay, let's pretend this is in fact the elbow joint. Here's my humerus, here's my ulna. If I do in fact flex at this joint, all right, you're going to see the coronoid process fit into the coronoid fossa, which is located anteriorly on the humerus. I'm sorry, I know that may be a little hard to absorb. Normally we would be working on this in the lab, and we would have it physically in front of us and be able to see it. All right. Good. I'm going to go ahead and stop us here just because it's late. I'm tired. I'm sorry. And my voice is kind of going right now. We will pick it up next time with the rest of the appendicular skeleton. We'll finish up the wrist, the hands. To finish up the wrist, the carpal region, we'll finish the hands. We'll also do the pelvic girdles, the femoral region, femurs, the lower legs, the legs proper, the ankles, tarsal region, and the bones of the feet. Okay. All right. If you have any questions,